Welcome, everyone. On behalf of the Centers for Medicare and Medicaid Services, the Administration for Community Living, and the Indian Health Service, I would like to welcome everyone to the Long-Term Services and Supports webinar series. My name is Nicole Pino, and I work for Kaufman and Associates. I will be your moderator today. Today's webinar is titled Promoting Access to Voting Among Elders and People with Disabilities. Please note this webinar series is supported by a contract awarded by the Centers for Medicare and Medicaid Services. The opinions, findings, conclusions, and recommendations expressed in this webinar are those of the presenters and do not necessarily represent the official position or policies of the Department of Health and Human Services or the Centers for Medicare and Medicaid Services. Today's webinar objectives are to explain how the program started, describe what was involved in selecting Indian Health Services facilities to participate, discuss how the program helps make voting more accessible to elders and people with disabilities, provide an overview of plans to ensure program growth and sustainability. Great, so I would like to go ahead and introduce Joshua Marshall, who's the Senior Advisor to the Director at the Indian Health Service. Joshua, go ahead and take it over.
Alrighty, good afternoon or morning, wherever you are in the world today. Thank you for allowing me to come speak to you today about this work and share a little bit about how IHS is working with the stuff as there's my outdated profile photo. I need to get a better one. But yes, as mentioned, so I'm Joshua Marshall. I'm the Senior Advisor to the IHS Director, Director Rosalind So. She is currently actually in Iceland attending some events with other leaders of the Department of Health and Human Services to learn about addiction recovery and resiliency programs as a model for what can work in Indian country when she returns. There's a little bit of background. So I am Northern Arapaho. I was born and raised on the Wind River Indian Reservation. And I joined, so as Senior Advisor to the Director, I'm part of the political leadership of the Department of Health and Human Services. I joined the Biden-Harris administration in earlier 2023. And in this role, I am Director So's primary advisor, as well as her primary connection between other political leadership of the department across the federal government and within the White House, specifically the Domestic Policy Council and OMB and the White House Council on Native American Affairs. Some items within my portfolio as a senior advisor include working on regulations and rulemaking, specifically around reproductive health care, catastrophic health insurance, oversight of the bipartisan infrastructure law, funding that was given to the IHS as part of that bill, which was a historic investment in our sanitation facilities construction program, which is responsible for bringing clean drinking water, wastewater management, solid waste management to Indian country. The bill, as you may or may not know, gave IHS $3.5 billion over 5 years to supplement our annual appropriations for these programs, and that brings us about almost 800 to over 900 million a year to address long-standing water issues in Indian country. So that's a big part of my portfolio. It also includes serving on the Not Invisible Act Commission as a federal representative, the commission that was stood up by an act of Congress when then Congresswoman Deb Haaland was in Congress, wrote the bill, and now as Secretary of the Interior, she implements it. I was on the commission to study that crisis of murdered missing Indigenous people and issued the historic report that we're coming up on its 1-year anniversary of issuance. Additionally, I do, just help keep track of and implement executive orders, everything from gender policy issues, climate and justice issues, making healthcare more affordable. And then this executive order 14019, which leads to what we're going to talk about today. Yeah, so as I mentioned, part of my role as senior advisor is implementing executive orders. These are orders issued by the president, and one such order is Executive Order 14019. IHS has been busy at work implementing this executive order, and so I'll go into what that is. So our run of show of today will be we'll talk about what is Executive Order 14019. What is the National Voter Registration Act, the NVRA, which is a major component of this work? Why the Indian Health Service in particular was both mentioned in the EO as well as appointed our Native Americans were mentioned in the EO and IHS as part of implementing that EO. Our progress to date at the Indian Health Service, including our work with why IHS is important, our work with elders as well, people with disabilities, our progress to date, and then finally end on some next steps. So this work has been getting a lot of great news and attention, and I'm asked to speak on it a lot. as not only within the federal government, but outside of the federal government with tribal leaders, native nonprofits, civil liberties unions, lawyer organizations, state governments and such. It also gets some bad press. People foil me a lot. I've become an enemy to some who want to stop the franchise from expanding, including subpoenas and lawsuits, but that just means we're doing good work, I would argue. So what is the executive order? So Executive Order 14019 was issued by President Biden on March 7th, 2021. It is one of his first executive orders that shows you the priority his administration has put on voting rights and access to the franchise. And within this EO, though, it specifically named Native American people and communities as a population of interest, as well as one that has unique barriers, and directed within the wording of the EO, the government to assess our barriers and work to address them. So that's kind of historic in the fact that Native Americans have a specific section within the EO. In general, the EO reinforced and encouraged designation of federal agencies under the NVRA to promote voter registration. Many departments were called out in this EO, list and tasked to do items, specifically the U.S. Department of Interior, U.S. Department of Veteran Affairs, and the Indian Health Service were among those that were specifically named to do activities in this EO. Specifically with Interior, for example, they were the first agency to designate facilities, and as the leader of implementation of this EO, they designated tribal colleges and universities. So first Haskell Indian Nations University in Kansas was the first, and then the Southwestern Indian Polytechnic Institute in New Mexico was the second. And they've done some other things throughout the department, but they were the first. I will say we have lapped them several times. So some departmental, intergovernmental competitiveness. The VA was also tasked with doing the same sort of NVRA designation work with pilot sites in Kentucky, Michigan, and Pennsylvania. To date, they have achieved that in Michigan and are working in Kentucky, Pennsylvania. This is slow moving work, and we could talk about that later. But for the Indian Health Service, President Biden committed us to designating 5 IHS voter facilities as pilot sites by the end of 2023. Obviously, we're in 2024, so we missed that deadline, but we are close to getting that mark. So I just want to just draw, most of my slides are very lawyerly, very wordy, so I try to introduce some sort of pretty pictures. So I just want to draw your attention. So the executive order is online. You just can Google Executive Order 14019. You can read what's all in the order, what it created, the deadlines it set, obligations and such. And then there's a plan that comes after, and that's where it lists IHS as doing these 5 sites as well as VA. One major outcome of this EO was a year after its issuance, they established a committee on Native American voting rights, which was coordinated through the WICNA, the White House Council on Native American Affairs, to study the unique barriers and challenges to voting in Indian country and how to address them. So this is a report of the interagency steering group. It took a year of them traveling. There were field hearings, both virtual and in person, speaking with academics, experts, tribal leaders, tribal members, all that good jazz, to comb through the issues, the literature, and then set forth a series of recommendations. One of which they highlighted is that the NVRA, as currently constituted, does not produce a lot of voter registration sites in Indian country. So we can touch on that in a bit. So what is the NVRA? So it was signed in 1993 by President Bill Clinton. It's also known as a motor voter law, right? This is when you go to the DMV, they ask you if you want to register to vote. So that's where its nickname is, a motor voter law. It was a major increase in the ability for people to register to vote, which we know is an important part of our right, of us exercising our right to vote. So the NVRA says states can designate state and federal government agencies as well as non-governmental organizations as nonpartisan voter registration agencies. And then there are 2 little buckets of these types of agencies. There are the mandatory sites such as DMVs, hence the motor voter law, public assistance agencies, SNAP enrollment, Medicaid enrollment, all that jazz. And then whatever, those would be the mandatory that the law says these must be designated and comply with the law. And then states can pass their own NVRAs so other state agencies can be designated. And then there are the voluntary sites. So these would be anything from if like in Oregon, they've decided all of their state health outreach agencies will be designated as well. They decide certain, schools can be designated. The states can decide what is voluntary, and leadership of organizations and federal agencies can also seek this designation. They can ask from the state if they would like to be designated and what are the steps to get to that. And each state is different. and how they get to that and how they certify it and all that jazz. But basically, the law specifically says states a facility that is designated receives special support and recognition from the state. But these voter registration sites must kind of complete these three basic functions: distribute voter registration and application forms to customers, help people complete their registration forms, and transmit any completed voter registration form to the appropriate election officials. So sometimes county clerk, sometimes the state, county recorder, all that. So the NVRA outlines the formal process for designating states to comply with the federal law. Some states, like I said, might pass their own state supplemental, which then of course would have their own state level processes for getting designation. Basically, but like I said, the federal designation just says that you are a voter registration agency. It's different than having voter registration cards. Anyone can do that. Any organization, any business can request blank registration cards from their county clerk and just lay them out for their customers or in their lobby. But as a registration agency, you're also responsible for helping complete them, fill them, and transmit them. Different states have different state officials who are in charge of these designations. Some majority of states, it is the Secretary of State who does this, or whomever he or she delegates it to. Some states it's a state board, like Maryland has a state board of elections that decides these designations. Some states it's the county clerk or the county recorder. Or in some states it's several, like in Arizona, it's the Secretary of State and the county recorder can both issue these designations. And then once formally designated, registration falls under the requirements of Section 7. That's some just lawyer talk. I will say on the voluntary, to the earlier slide on these voluntary designations, I've noticed, I've learned working through this process, talking with other people, especially these state election officials, that many have not ever, or at least not since the law was early, when the law was passed, so in the 90s, have done these voluntary designations. So when IHS approached them saying we're interested in some of our sites becoming designated, many states were like, well, this hasn't happened. We've never done it, or B, we haven't done it in so long, we forgot how to do it. So it was very interesting to work with the states on like going through the process, what the process would look like, developing it. So many of these states, we were the first, an Indian Health Service facility was the first to get voluntary designation under this nearly 40-year-old law. And because of that, when other organizations now seek this designation, because we are becoming more popular, that was a goal, was a pilot to spread the word, they will be working in a system that was developed to serve Indian people. So that will be interesting. So I'm just gonna stop here to highlight a lot of this work was done with partners, nonprofit partners, namely the National Congress of American Indian, the Native American Rights Fund, DEMOS, American Civil Liberties Union. Those were the four primarily IHS worked with, but there's a large coalition of nonpartisan voter advocacy and legal advocacy organizations that helped with various other parts of this EO. But those four are the ones we work primarily with. I would point that NARC has done a lot of great webinars on this, on NVRA designation in general. So organizations or the facilities that aren't IHS can also benefit and request this designation. And other ways to get involved. I also know they produce a lot of great resources. So I point you to their website, NARF voting rights. They have a lot of great resources on registration, the importance of voting to Native people, the unique barriers and challenges and how they're working to address them, as well as just some good interviews with a lot of people and talking about the history of Native voting. You know, this year marks the 100th anniversary of the Indian Citizenship Act. So, you know, as those of you who know federal Indian policy, there's various points in time when various subgroups of Native Americans received some form of citizenship. But 1924 is really when it was just finally all were considered citizens of the United States. And even then, there was still some work to do, just like with, I'm also half Black, just like, although my ancestors were granted the right to vote, it really took until 70, 80 years after that fact for the civil rights era to help implement that stuff. So same thing, even though we got that, we were considered citizens in 1924. So we're still working on making sure we can enjoy these rights and franchise as citizens of this country. But I encourage you again to check out those organizations. They have a lot of great resources. Also, the National Council of Urban Indian Health does a lot of great work on on Native voting. I encourage you to check them out. So why the Indian Health Service? I know a lot of the some of the initial conversations I've had with both at the clinical side of the house, as well as tribal leadership in some cases, community members, was why the Indian Health Service. We're a healthcare system, we're not a voting system. And I understand that none of this work takes place within the context of the clinical visit with a provider, and we can talk about that later. But there's important reasons why IHS was specifically called out. So the Indian Health Service ITU, that should be I/TU. So that stands for Indian. So IHS run facilities, tribally run facilities, and urban Indian health programs serve approximately 2.6 million American Indians and Alaska Natives. And those ITU, as you all know, the Indian Health Service, it runs a healthcare system, the Indian country, but it's divided into federally run facilities, which is about a little less than half of the IHS budget. 55% of the IHS budget goes to tribally administered healthcare facilities through compacts and contracts via ISDIA Section 630 or ISDIA's Public Law 638, the Indian Self-Determination Education. So we call those tribal sites. So they are part of the Indian health system, but they're not run by the IHS. They're not federal facilities. And then of course our urban Indian programs, which are under Title V of the ICIA, which is how we extend our trust responsibility to urban Indians. So altogether, those three sites, the federal sites, the tribal sites, the urban Indian sites, make up the Indian health system. 34% of voting age American Indian Alaska Natives are not registered to vote. That's a huge population. 1.2 million eligible people who are not taking advantage of the franchise. And we know that civic engagement is a proven contributor of the social determinants of health. The higher rates of civic engagement, including voter registration and voting, are proven to show higher outcomes and all the sorts of health disparities that the Indian Health Service works to address. It also just moves public policy in a manner that helps address public health and health concerns of all populations, including American Indians, Alaska Natives. And because of that, this work fits firmly within the mission of the Indian Health Service, which is to raise the physical, mental, social, emotional, and spiritual well-being of American Indian and Alaska Natives to the highest level. So we're all about the SDOHs over here. Civic engagement is a proven contributor, just fits within our mission. Additionally, as that report I pointed to earlier outlines, there are a lot of barriers that AAI people face that are unique to voting and voter registration. Many of these mandatory NVRA sites, the DMVs, the public assistance, many of the county registration, the county clerk's office, public libraries are more than 50 miles away from Native Americans. Those of us who did grow up in rural parts of Indian country on the reservations know that they're far away when you want to go get those things. Often homes on reservations and in tribal lands do not have street addresses, so that complicates registration. That's also hard for them to get mail. So that's why we have a lot of people who double up on PO boxes and all that stuff. We also know that Native Americans are rejected at a higher, Native American registrations are rejected at a higher rate than other groups. And that could be for a variety of reasons, some nefarious, some not so much, but that is, a reason why IHS is called out. And IHS, as I mentioned, we are the Indian Health Service, all of us, federal, tribal, and urban. We are the 17th largest healthcare system in the country. We have a footprint that spreads into 36 states, over 600 medical facilities of some sort, everything from Trauma One hospital and medical centers to small clinics in the bottom of the Grand Canyon. So we have a massive footprint, and we have culturally competent employees who are from the community most often, so speak the language, know the community. It's a trusted place people go for services. So it should be a trusted place people go to get voter registration when they're also going to get their healthcare or services from an IHS facility. So we have a unique way to help address these obstacles to registration. And that's particularly true for older Americans and Americans living with disabilities, right? 47% of American Indian and Alaska Natives are 65 plus. So if over nearly half of our population that we serve are 65 plus, they are having access to quality voter registration engagement as we continue to expand this program. They will be able to, those are the ones that would be a population that would really benefit from added assistance in filling out, registration forms. If English is not their first or second language, we'll have in many of our facilities people who will speak the language to help translate them, who can help figure out what their address is or how to fill out the address component if there's not a street address. So there's just by virtue of us serving this population, we'll be serving a disproportionately large number of older Americans. And at least a third of American Indian Alaska adults over 65 have one or more disabilities. So again, this is by working to address bringing IHS to have high quality voter registration, we'll be serving these populations. I'd also say there's a lot of partnership potential with the Administration for Community Living. I know some of our facilities have received some sort of grant and collaboration with ACL, which is also part of HHS. Some of our urban sites, for example, in Arizona, partnered with the Intertribal Council of Arizona to organize a voter registration event and education event that was funded by both IHS and ACL, the Administration for Community Living, under their Title VI program. So there's a lot of ways to collaborate, a lot of populations that within HHS, Medicaid, ACL, IHS that can work together to continue to bring this opportunity to our elder Native Americans and family members living with disabilities. So these are just want to draw attention to these two resources, if you will. So like I said, voting or civic engagement and voting rights are social determinants of health, contributors to social determinants of health. So there was a journal article published in the Journal of the American Medical Association, a peer-reviewed journal it's called their Health Forum, that comes out about 20 times a year. It's peer-reviewed, that talks about increased voter participation through healthcare-based voter registration. That's proven that people who do register to vote in a healthcare-based situation tend to actually vote at higher rates than people who don't register in those sites, who register in different via DMV or public library or so forth. So not only do we have, again, and then they highlighted the SDOH contributions of engagement. So not only do we our voting engagement contribute to SDOH, doing so in a healthcare facility makes them more likely to vote in general and exercise their franchise. And then this other document is a resolution from the National Congress of American Indians issued in 2022, calling on reaffirming their support of the EO, the importance of the NVRA, and that IHS should continue on the path of seeking these designations. I will also just take a moment real quick. So to pause here. So before I joined the administration, I was also during the Obama years, I was at HHS, but in the interim, I was at a think tank called the Center on Budget and Policy Priorities. And we focus on federal tax and budget policy as well as state tax and budget policy from a progressive lens. So progressive tax policy and social programs to help benefit low and moderate income families. I worked specifically on the state fiscal side, helping look at state fiscal revenue and working with our state-based think tanks to address policy priorities in the state level, and work to integrate a pro-tribal sovereignty and Native American lens into our work to the extent of getting analysis in state budgets, how it impacts Native Americans. And so one little hook I like to make with this voting, and I say this every time I could talk about it, it's important that Native votes, not just for the social determinants of health, and not just because we're citizens of this country, but also because we're citizens of states. And states control a lot of the funding and a lot of the policies that impact a lot of our health and a lot of our well-being. States have a big role to play in achieving a vision of a thriving communities, including in Indian country. States and local governments account for half of all domestic public sector spending, including 92% of all K-12 education, 98% of all public colleges, and 93% of all non-defense infrastructure. All that money is controlled by the states. And states and localities incarcerate 91% of people in prison or jail. So they have state governments have a massive control over all citizens, and including Indian country. And it's important that Native Americans vote and register. So not only are voices heard on the federal level, they're heard on the state level, where a lot of the things that contribute to the well-being of our communities are decided on the state level. So I always like to put that plug in, another reason why it's important. States can't just say, oh, the tribes, that's the federal government's responsibility. No, we're also citizens of the state. And as citizens of the state we reside in, we're entitled to have our voices heard and you to respond to our needs. So what are the current sites? So we're almost there, y'all. So the first site was Native Health Phoenix. To be honest, a lot of this EO work was kind of lagging behind before I showed up. It's just, that's just the reality of staffing up a new administration. Although I joined early in March, it took a lot of work, like I mentioned, to get the states on board. Even if they weren't very enthusiastic, and most states are, to expand voter registration. Some of them, they hadn't done this in a while. So it's working with lawyers to, can a proclamation suffice? Do we need memorandums of understanding, et cetera, et cetera? How do we do this? Then you get the lawyers involved and things take a little bit longer. But we got it. So the first one was October 2023. That was Native Health Phoenix. All three of their sites in Maricopa County. That was followed by earlier this year, Santa Fe Indian Health Center and the Crown Point Health Care Facility, both in New Mexico. That should say, I'm sorry, that was a typo on my end. It should say October, effective on Monday. The Western Oregon Service Unit, which is in Salem, which you may be aware of the Chamawa Indian School, which is its anchor institution, but it serves over 100 different tribal members who live in the Western Oregon area, or members from 100 different tribes, I should say, in the Western Oregon Service Unit. And then Fingers Crossed Native American Lifelines, which is an urban Indian organization, much like Native Health Phoenix, based in Baltimore. We're expecting that designation to be approved at the end of the month. They submitted their application. The board, it has to be approved by the State Board of Elections. The state administrator of elections is very confident that this will be approved. So fingers crossed this happens soon, and that will be our fifth. And so just to pause here, so the EO said 5 facilities across 5 different areas. So the IHS areas are divided into, we have 12 different areas. So Native Health Phoenix covered the Phoenix area, which includes up into Utah and Nevada. The Santa Fe Indian Health Center is for the Albuquerque area. And then the Crown Point Health Facility, which is a little bit north of Gallup, is for the Navajo area. So that's why there's 2 in one state, because there are 2 different areas in that state of New Mexico. And then the Western Oregon Service Unit is in the Portland area, and then the Native Lifelines is the Nashville area. We wanted a mix of urban, tribal, and federal. These are, as you can see, these are 3 federal and 2 tribal. We're still working on getting some urban, or not urban, tribally run facilities, either Title 1 or Title 5 specifically. So exciting news on that front. So pay attention. Stay tuned, if you will. Some fun photos, like I said, to not make it too lawyerly. So every time we do these designations and they're official, we like to have a little celebration with leadership of the service unit or the organization, tribal members, tribal leaders, state government officials, community members. So in that first little corner, you see me giving a speech. That's what political appointees do. We give speeches. But this is at the Santa Fe Service Unit, celebrating their registration. You can see the area director there, Dr. Thomas, speaking with some members. The VA showed up. The other woman at the podium speaking is Charlotte Little, who is a member of the Navajo Nation and also a state senator actually, who was pushing for a lot of voter stuff in New Mexico. She came and spoke. And we had staff from the Secretary of State's office speak as well, who was very helpful in getting this approved. The picture next to her, you see in the U.S. Public Health Service Commission Corps uniform. She's the CEO of the Crown Point Service Unit, and she spoke. We did both celebrations in Santa Fe because they were close together, to speak about the importance of Crown Point and the community it serves up there in Crown Point. I don't know if anyone here is from the Navajo Nation, but Crown Point, it's a trek from places, and so having that a more rural location is key. On the top of that was our first one. That was Native Health Phoenix. There I am again speaking, but you also had leadership from the Phoenix area office, Admiral Wiake. We had members of the board from Native Health Phoenix. The IHS Deputy Director Ben Smith was there. Secretary of State Adrian Fontes was there. We actually even had electronic kiosk where people could vote, because we did this during one of their community fairs where they had thousands of people coming through. So it was nice. It was a big event, got a lot of publicity. They had their mascot Alberto, that's the bear, even showed up. He couldn't register to vote though, but mascots can. But but it was a fun little event. And then here's the State Board of Education, or State Elections Administrator from Maryland, speaking with some members of the urban Indian population in Maryland at the Baltimore Native Lifelines Community Fall event, which is when they announced that they had submitted their official request to be designated and that the vote would be coming at the end of the month. So it's always a fun community event. People come out, people enjoy this. It's important that they know that they can vote, have easy access to voter registration and all that, with staff that they trust, people that they trust. So what are some next steps? Well, we will continue doing stuff like this, continue speaking to groups who request that we come speak to them, thinking about how we can address different populations and partner with, the elder Americans, people with disabilities, and how we can partner with, for example, now I'm thinking about new ways to work with the Administration of Community Living, new ways to work with labor, new ways to work with a bunch of other ways that we can partner on this stuff, because it's EO that is across the government. We had a blog, we like to blog about this or write about this. We had a blog on National Voter Registration Day from Director So about the importance of voter registration for social determinants of health. Be sure to check that out. We're highlighting on our website right now, vote.gov, for people to register to vote when they come to the IHS home webpage. We like to pitch to the media when you go out to these celebrations, so we get local coverage. We do that all the time. We also include social media engagement, we live stream some of our events out in the community. I had a webinar earlier this year on how to pursue and get into the more technical aspects of NVRA designation and operations. And that was more for people who actually run our healthcare facilities, urban, tribal, or federal. I am creating a toolkit for interested sites and tribes so they can learn more about it and pursue this. Um, just in terms of the calendar, most voter registration for this upcoming election is over in most states. I won't say all, because there's a lag. There's usually they have a buffer between registration and voting, except in 6 states. But of course, this is for all elections, not just the most immediate one. So people will hopefully continue as they see the success of these pilot sites, want to learn more about it and do it themselves. That's the goal. And so we'll be creating a toolkit that will kind of be housed, that will be specific to how IHS works because we are a healthcare facility and have unique considerations and concerns, but hopefully can be used by others as they seek this designation for in the years to follow. Again, I speak at national events all the time. I was at a White House convening earlier this year about this. There's summits, try to get the word out as much as possible. And I have a pipeline of interested federal, tribal, urban sites in development. Just for a variety of reasons, we don't like to talk about which ones are in development because we don't want them to be derailed. It used to be that this type of work was apolitical and it is apolitical, but there are certain elements out there that would make this an issue when it needs to not be. So we try to keep them in development as quiet as possible. But just some more photos so it doesn't end up like a lawyer presentation. There I am at the White House with Heidi Todeschini, who's senior advisor at my equivalent to the Secretary of the Interior, who leads this work over at Interior, Governor Lewis from the Gila River, colleagues from Illuminative and National and NARF, Native American Rights Fund, and then the Special Assistant to the President for Democracy. And so we had a panel about voting rights in Indian country, invited tribal leaders from all over the country, Native organizations, Native nonprofits. And that was a panel about the work of the EO and the importance of NBRA. We also are voting registration in Indian country. We also debuted a video that Illuminative and NARC put together about celebrating the 100th anniversary of the Indian Citizenship Act. Below that is a photo of our Deputy Director, Ben Smith, speaking about voter registration with the CEO of Native Health and Chairwoman Janet Alcary from Standing Rock Tribe at the Tribal Self-Governance meeting conference that was in Gila River this year. That's a huge conference. 1,500, 1,600 attendees. This was a plenary session, so a lot of people in the audience learn about voting in Indian country, the work all these organizations are doing, and then the EO and IHS's role in that. And the next to that was just some of the tribal leaders that were in attendance at that White House event I spoke at. And you can see in the very front is Peggy Flanagan, the Lieutenant Governor of Minnesota and a member of, I can't remember what tribe. No, Ojibwe tribe. Sorry. No offense to Ojibwe's out there. I can't remember which tribe. Who knows? Maybe she'll be having a different job soon. Who knows? But yeah, she's the first highest elected Native American woman in the country. And then above that is just the toolkit I'm putting together about voter registration and Indian Health Service. And that is that. I short and sweet. So we have time for questions and discussion, but that's my contact information. You can email me or call me. People like to email and text more, but sometimes picking up the phone is the easiest. I could say as a appointee, we like phone calls. Get stuff done quick. Yes. Here's a resource as long as I'm around. That is it for my presentation.
Yeah, thank you, Joshua. So as he mentioned, this is our time for questions. We'll first be addressing questions already submitted in the Q&A box. I do see a question, Josh. I'll go ahead and read it out loud. Could you say more about the projects undertaken by federal agency to designate facilities that would serve as voter registration pilot sites? I think those were the list of facilities that you were using. I don't know if you want to speak more about that.
Yeah, so are you talking about the 3 service units?
Yes, that's correct.
The process? Well, I mean, the process, because they're federal sites, I have a little bit more direct control over them. So it was, but all right, I guess identifying, we asked areas to think about, the area directors to think about federal tribal sites that might be good candidates for this. On the federal side, we approach the service unit leadership to say, we think this would be a good site to work with the state on receiving designation. The CEOs of the service unit, we would get their buy-in, work with buy-in. We ask them, this is what we want. And then, they designate staff who will be like the coordinator and the main contact. And these usually, and then they will do the training of the front of house staff. Again, this doesn't touch the clinical side. So no pharmacists, no nurses, no doctors are asking these questions. It's all the people at the front of the house, when you're doing your paperwork, updating your address, giving new insurance at those points in time, you'll be asked if you want to register to vote. So those staff members get the training. And then the designation is issued. I'm just kind of confused. Curious how it works uniquely at a federal site versus a tribal site, or the process would still be the same. I think it's just the authority is a little bit different. Tribal sites, usually a tribe, from the tribes I'm working with, a tribe will pass a tribal resolution in support of this, right? Because they are the owners of the facility, or however way the tribal government has decided that they want the facility to accept the designation. On the federal side, we accept it as the federal IHS facility, accept the designation. It goes through our federal process.
Okay, great. Next question I have is, could you talk more about how civic engagement contributes to social determinants of health? I know you mentioned that earlier in the presentation, how civic engagement is a proven contributor to social determinants of health. I don't know if you could speak more to that.
Oh, I say this all the time. And there's a lot of evidence, but it's the social determinants of health, or all these things. But civic engagement contributes to a sense of belonging, right? That helps with social determinants of health. It contributes to a sense of control over your future. Getting rid of the sense of helplessness. Right? People who engage in voting tend to have a better outlook of their future, more sense of control over the direction of their community. Involves more community engagement and involvement. Also, there's direct policy outcomes. Usually people who vote, who are engaged in voting, tend to pay or more engaged in what the public policy is around, for example, funding of public health, funding of nurses, funding of school nurses, gun violence, all that stuff that contributes to social determinants of health. I'm not a public health expert though, so I can't get into the weeds about it. The broad concepts of how it's important.
Great. I did have another question come in. So my IHS facility is interested in promoting voter registration. Who would we contact regarding our interest?
My first question is, what facility?
It's not listed here.
I would be the contact. Just send an email to me.
Okay, perfect. Next question I have is, where would I find the June 2024 webinar on how to pursue NVRA sites? I think you mentioned this earlier in your presentation on your highlights of the importance of voting, and where can they find that webinar?
Yeah, so that webinar, we did not record it for a variety of reasons. We were in the middle of litigation, so we didn't want anything recordable. But not because we were going through anything untoward. I just was tired of responding to FOIAs. So we did not record it, but we will be putting a toolkit online that's basically that whole thing that will go outline it, and maybe have another webinar that we will record now that some of that matter has been resolved.
Perfect. All right. And do you know when will the toolkit be available?
I can say after election. Busy time right now, guys. But so I will commit to you by the end of the year. I'll make that commitment.
Great.
Because it will be great. Like I said, at this point in time, we're too close to this current election for people to register. I mean, there's a few states that still, but most states will be closing up their registration shops soon, and then focusing on just administering the election. But of course, this is for every election, not just one. So in the new year would be a great time once you're because you also have to work with your Secretary of State's office or whomever the authorizing officials are. So they're going to be busy too, running the elections, counting the votes, certifying them, all that stuff. So that will, go past it well into beginning of the year probably, and then they'll probably want to take a break. So, but yeah, by the end of the year, it will be a good time for the facilities to learn about it and get interested in it. And then beginning next year, probably a good time to start reaching out to your secretaries of state to engage with them on the process. And that will all be in the toolkit with suggested letters, all that good jazz. I want to thank you for inviting me to speak and share some of this information. I think, and thank you for everyone for sticking around and learning more. I do hope that, like I said, I'm committing to the end of the year. So I have to figure out where it goes on IHS, but I want this information out. The EO, we have done our goal. The pilots are getting more interest. That's one of our things. We want people more talking about it. Their voting is important. We as Native people know that. We understand that. Voting in our tribal elections, federal and state elections. And this work has kind of been the high. I have enjoyed everything I've worked on during my time here in the Biden-Harris administration, but this EO work is one of my favorite things to do. I think it is both from us IHS facility level, like facility staff feeling connected to a larger project working on the federal level, like, oh, the president does EO. What does that mean? Now they're seeing like on the ground tangible evidence of what it means when a president issues an EO. So they feel part of that work. The community members feel part of that work. People who've worked in voting rights, native voting rights, are happy to see this work. So I think it's one of the more rewarding things I've done. It's very important, and we all know it's very important for us and our people to be registered to vote and get voice and have control. So I think thank you all for your interest. I hope it spreads. I hope we see voter registration sites everywhere I go in Indian country.
Great. I would like to thank you, Joshua, for joining us today. In closing, I would also like to remind everyone that today's webinar was recorded and that the audio and presentation slides will be made available online at cms.gov. Thank you again for joining today's webinar. Our session is now concluded. Thank you.
Bye-bye, everyone.
Bye.